Good afternoon. I would like to thank the organizers for, again, contacting me to do this event. As Ms. Cho stated, I am TESHA Samuels, and I wanted to be here today to tell you how my life has changed as a result of one of the clinical trials you heard Dr. Tisdale speak about. However, I'm not sure most of you here today, as well as many people I've met since enrolling, are asking, what made you want to do that? I think most people who begin to even think about enrolling in a clinical trial for themselves or for their child have questions such as, is it possible to do that? What signs suggest it can do? If I decide to go forward or not go forward with this, can I live with that decision? To answer those questions, I had to take myself back to the beginning. For me, that journey to that point began when I was a very small child, born to a single mother who also was surrounded by a village of loving grandparents, great-grandparents, and church family. I stayed sick with infections, colds, and pain, but it wasn't until the age of 2 that a doctor was able to connect the symptoms with the diagnosis. That diagnosis being sickle cell anemia. Now that we had a diagnosis, it was helpful because now you could at least put a name to an illness that at that time was heard of but never quite talked about. Well, in my household, we had no choice but to talk about it because the disease progressively became worse. At the age of 7, I experienced an aplastic anemia crisis, which is a condition where the bone marrow wasn't producing enough red blood cells to keep my hemoglobin levels high enough. Just for me to function without having an exchange transfusion and oxygen. I remember that this being the first crisis I had showed us how life-threatening this disease really was. At the age of 13, I had a transient ischemic attack, or TIA, which is what it's called, which for months presented as a mild stroke, and it affected the left side of my face and arms, causing weakness. It was shortly after that sickle cell began to infiltrate every part of my day. I began to notice that with every day came a level of pain that made my life that much harder. By my sophomore year of high school, I had to request to be homeschooled just so that I can continue to get an education. In order to have some sort of normal life, it took high doses of opioid medications, blood transfusions monthly, and 10-hour nightly infusions of Desferal. At the age of 17, I suffered acute chest syndrome, had 3 chest tubes, and a deflating lung, and had to be placed in a medically induced coma. This is all before I graduated high school. Even after that, I still wanted to strive for a life full of everything that I believe God had promised me. I attended Howard University, but due to illness was unable to complete my degree, but still went on to pursue a medical assistant certification. I continued to have at least 2 to 3 painful crises a year, which required hospitalizations, experiencing excruciating pain on a daily basis, and still held down a full-time job. I met the love of my life when I was 21 years old, and we married in 2008. We wanted children, so in 2011, we got pregnant, but an ectopic pregnancy, which caused yet another crisis. We were told this isn't a good idea. In my early 30s, after receiving over 250 blood transfusions, hemochromatosis, which is iron overload as a result of those blood transfusions, it was so high that I had to take 1 day off of work a week just to get Desferal treatments in a clinic setting for 10 hours. Through the years, I did search for advancements in the clinical trial sector of healthcare by asking my doctors until many years later, asking my doctors, but for many years there wasn't much that I qualified for because I didn't have a sibling until many years later. And I was told that the bone marrow transplants work better in childhood and early adolescence. In 2014, I met a student researcher with the NIH at a Stomp Out Sickle Cell Walk in Washington, D.C., and she told me about the INSIGHT study at NIH. This study was non-invasive, but only collected blood and hair samples and took 1 day of my time. But for me, it showed me that someone was finally interested in the disease that plagued me all my life. In 2015, The last straw for me was having the hematologist say that liver dialysis would be the next step. And other than that, we were doing what we were doing already. There isn't much else. So now, enough was enough. Desperation and pursuit for answers was at an all-time high. I began to feverishly search for the email address of the student researcher to see if there was anything else that I could possibly qualify for within the sickle cell. My persistence paid off because one email chain led to another, and I was directed to the NHLBI research at NIH. They told me about the autologous gene therapy transplant, which was, as you have heard from Dr. Tisdale, utilized my stem cells, cutting out the genetic mutation that causes sickle cell and replacing it with modified gene. Well, I'm not a scientist, and so that was my layman's explanation of what it actually took. The process which they laid out for me in great detail, both in writing and verbally, was a lot to take in for me and my family. I was contemplating signing up for something that will put my body through high doses of chemo, make me menopausal before the age of 40, take months in the hospital, and agree to at least 3 years of monitoring. When I considered those things and looked at what I had already gone through, this to me was a godsend. It took a year for me to convince my family of that fact, but I got them to see that as well. When I walked into NIH on March 5th, 2018, one day after my 35th birthday, not knowing what to expect or how to feel was challenging to keep my emotions in check. However, I was surrounded daily by doctors, nurses, nutritionists, etc. They were more than knowledgeable of this process and how to care for me. Just knowing that made it a little easier to trust the process, no matter how bad the days got. The busulfan chemo was extremely harsh on my body, but especially in my throat and mouth. I lost my hair, my strength, my appetite, but everyone kept telling me this was just temporary. Keep the positive attitude. One of the greatest gifts was to know that I had persons I could call who had just gone through it 1 year prior. They both had open door policy for me to call and ask them questions. I tried to do the same with a young man whose journey with gene therapy began just 2 weeks after my own. Now here I am, almost 2 years later, and able to report that I no longer have pain every day. I no longer need to take narcotics just to get out of bed. I haven't received a blood transfusion since August of 2018. I'm making it a point to live out loud because for so long I was unable to do so. I came here to maintain my hope in the health and the rebirth of what science is doing today. So I'll leave you with this. The NIH Clinical Center tweeted last year that clinical trials are a part of clinical research and are at the heart of all medical advances. Clinical trials look at new ways to prevent, detect, or treat diseases. This statement sums up my reasons why it's needed. It sums up the reason why I did it. It did not prevent or detect my sickle cell disease, but it sure did treat it. And for that, I am truly grateful. Thank you for your time.